thousands of people around the world have been able to overcome their low back pain thanks to the McGill method. And in many of these cases, people had already tried a variety of different treatments without success. Hi, I'm Dr. Jared Wilbrink. I'm a chiropractor and a certified McGill method provider. I help people overcome their back pain even when nothing else has worked, so that they can get back to living without having back pain dominating their life. As a McGill method provider, I've seen how people's lives have been transformed through the McGill method. I've been able to help people overcome their back pain who had been suffering for literally decades with back pain. I've been able to help people overcome their back pain even after having tried numerous other treatments without success. And I've been able to help people overcome their back pain who have been suffering from a wide variety of different conditions. Things like disc bulges or disc herniations, sciatica, disc degeneration, joint pain, sacroiliac joint pain, spondylolisthesis, stenosis, to name a few. In this video, I will explain to you what the McGill method is, what makes it unique, and what type of patient it is for. The McGill method is an approach to treating low back pain that involves identifying the specific stress that's causing your low back pain and then removing that specific stress from your daily life so that your back can heal and your back pain can resolve. Imagine you were a framer and you hit your thumb with a hammer. Now, as long as you didn't hit your thumb again, relatively soon your thumb would heal and the pain would subside. But if you kept hitting your thumb over and over and over again, it wouldn't be long before you had chronic thumb pain. And this is what happens in the majority of low back pain cases. It's very likely that the reason you have chronic or persistent low back pain is because you're doing something on a regular basis that irritates your low back and keeps it sore. Now, what the McGill method enables me to do is to identify the specific cause, the specific thing that's irritating your back, and then to show you how you can avoid or remove that irritant or that cause from your daily life, from your postures and movements, so that your back can heal and your back pain can resolve. So the McGill method is all about finding the cause of your back pain and removing the cause of your back pain so that your back can heal and your back pain can resolve. In order to understand what makes the McGill method unique, it can be beneficial to think of pain conditions as having three components. You have the symptoms, you have the source, and you have the cause. Now, in the situation of back pain, the symptoms would refer to the pain you have in your back, or if you have sciatica, the pain you would experience down your leg. The source refers to the specific tissue in your back that is irritated or injured. And the cause refers to the specific stress that is irritating or injuring the tissues in your back. So you have the symptoms, the source, and the cause. Now, most treatment methods address the symptoms or the source. So for example, if you were to take medication for the pain, you would be addressing the symptoms. And if you had something like surgery for a disc herniation in your low back, you would be addressing the source. Now, what makes the McGill method unique is it specifically addresses the cause. And the reason for that is that once you remove the cause, you will no longer be irritating or injuring the source, which will result in the symptoms subsiding. So if we address the cause, the source can heal and the symptoms can be resolved. Before I explain who the McGill method is for, I'll first explain who the McGill method isn't for. So the McGill method isn't for the person who has back pain due to some sort of pathological process. So the person who has cancer or an infection or a fracture of their back isn't suitable for the McGill method. It's also not for the person who has back pain due to some immunological condition, so something like ankylosing spondylitis or rheumatoid arthritis. It also isn't for the person who has back pain due to a problem with their internal organs. So if someone who has a kidney infection or a bladder infection, for example. It also isn't for the person who has constant, unrelenting pain that doesn't change. So they always have constant low back pain. The McGill method also isn't for the person who has back pain with neurological symptoms that are progressively getting worse. So increasing numbness in their foot or increasing weakness in their legs. It also isn't for the person who has back pain and has lost bowel or bladder function. So those are some of the people that the McGill method isn't for. Now in contrast to that, the McGill method is for the type of person who has chronic or persistent back pain, for the person who may have tried various other treatments or therapies without success, for the person who has back pain that varies depending on what they're doing, for the person who has good days and bad days or better days and worse days, for the person who isn't looking for someone to fix their back pain. The McGill method is for the person who realizes that there isn't a quick and easy fix to back pain, but that biology takes time and it can take time for back pain to resolve. Now, if the type of person that I just describes you, then I encourage you to get in contact with us by clicking on the link in the description box below to begin your journey today to overcoming your low back pain. If you know of others who may benefit from the information in this video, please share this video with them. Otherwise, in order not to miss any of our future videos, please subscribe to our channel. And as always, thanks for watching, and we'll see you next time.